Hi, it's Dr. Mo here from Fairfax Chiropractic Care Center in Virginia. I want to talk to you today about scoliosis. I get a lot of teenagers in here, and a lot of parents that come in here, they seem like they're confused and they don't know where to go, where do they start. And I think it should be, first place should be somewhere as a chiropractor, or maybe even the orthopedists. Unfortunately, they look at the scoliosis and they tell you to come back in 6 months because it's 14 or 15 degrees. What does the scoliosis mean? Scoliosis basically means kind of a deviation when you're looking at it from back to front of the spine, right? So if you have 14 degrees, it's not that much. And if you're 30 years old, 40 years old, 15 degrees scoliosis is nothing. But when you're a teenager and you're 15 or 14 years old, and most of my patients are female that have scoliosis. When you're 14 or 15 years old, that scoliosis could go from 15 degrees and it could go to 30 degrees or 20 degrees in less than 6 months. So let's say you go and see an orthopedist and they say, oh, you have a 15 degree scoliosis, come back in 6 months, we'll x-ray it again. If it's moved, then we'll take care, we'll talk about it. Well, if you come back in 6 months and that scoliosis is 20 some degrees, what are they gonna do now? They're gonna brace it, and what is the bracing gonna do? When they brace it, the muscles are gonna start atrophying. So you brace it and it goes from 20 degrees, in about a couple months, it goes to 30 or 40 degrees. And by then, what do they say? You gotta do surgery. And here we are, by that time you're 16, your daughter is 16 or 16 and a half, 17 years old, and they're here, they're gonna put rods on each side of the spine. And that rod is gonna keep it from moving, and they can't play sports hardly, and they can't do anything else except put this rod and have big gashes in the back of their backs. And as a teenager, what's the most important thing to you is the way you look, right? And then you have, every time you go to the pool, you got these big scars in the back. What does a chiropractor do? So I have a lot of patients that come through here. The biggest thing we do is we first x-ray it, and every so often we keep x-raying. Not that I'm a big x-ray fan, but we need to see if it's deviated. And while we're under care, we basically put you on these different machines. We put you on different things to start shifting the scoliosis. One thing that I do see with scoliosis is my patients, they lose their neck curve. And so we restore that neck curve. Once the neck curve restores, it takes that pressure off that scoliosis. So then everything deviates over. We do a complete exam, and from the exam, we'll see where you're at, what degree you're at, and we see if it's moving or it's stabilizing. The biggest thing we want is in several months, years, is to stabilize and get you to a point where it's not moving anymore. Once it's stabilized and it stays at 15 degrees or 14 degrees and you're in your 20s and 30s and we know it's stabilized, then you know you're out of the trouble there. So again, if you have scoliosis, come on in, let's get an exam and give us a call at 703-277-9590. Again, 703-277-9590. Let's get a complete exam and see if there is anything that we can do to help it. By the way, I have had scoliosis patients that come in here and they had 30 or 40 degree scoliosis. We don't treat it here. If it's that severe, then we send you to a specialist. And the specialist that we treat with, he is phenomenal. He's not in this area. We'll talk to you when you do come in here. All right? Thank you.